Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Phindile Chowa. She's an emergency medicine physician. Today's KevinMD article is Postpartum Crisis, a physician's call for comprehensive maternal support. Phindile, welcome to the show.
Thank you. I am so excited to be here.
All right. So you're an emergency medicine physician in Atlanta. Tell us a little about your story and journey to where you are today.
For sure. So I'm originally from a small country in Africa of about 1 million people called Eswatini. From the very age of 9 years old, I decided to choose a career in medicine. And that was really fueled by the inequities that I witnessed as a small child. So my grandmother was pretty sick growing up, and I had to go back and forth to the hospitals with her. And so I got to witness the healthcare system in my country. I got to witness patients during the HIV/AIDS pandemic. I got to witness stroke care, end of life care. And from the age of 9, I decided that medicine was what I wanted to do. And so came to America in 1995 and ended up going to undergraduate at University of Pittsburgh. I did my medical school at the University of Pittsburgh. I originally thought that I was going to go into OBG, and at the very last minute, I decided that I wanted to do emergency medicine because I wanted to do it all. I loved the excitements. I loved the change in the day to day. And so went to Boston where I did my residency at the Harvard affiliated Mass General and Brigham hospitals. And then I moved to Atlanta, where I originally came to work for a large academic institution. And I currently am a concierge physician, and I have a particular focus on helping postpartum moms in the 4th trimester.
All right. So your story leads into this KevinMD article, Postpartum Crisis, a physician's call for comprehensive maternal support. Now, tell us about the events that led you to write this article in the first place. And for those who didn't get a chance to read it, of course, tell us about the article itself.
Yeah. So, after COVID, we all went through sort of this existential crisis and reevaluating our lives and what do we want to do? And are we living a purposeful life? And I love medicine. I went into medicine for the interactions that I have with people. But after COVID, I really wanted more. I went through a transformative time within myself and started to reevaluate my day to day and trying to find purpose in that. And so I decided after being, going through COVID, doing administrative work, that I wanted to do something that was less reactive in terms of medicine, but I wanted to focus a lot more on preventative care and just, focusing on those interactions with my patients. So I left my full-time job and I went to do concierge medicine. And those initial few months of me seeing patients within their homes, I started getting a lot of calls from moms.
Hmm.
It may start as a call for, I'm having maybe mastitis or I'm having some issues with my C-section. And when I would go in there, I would speak with these moms and I saw it was more. They were struggling with a lot of things in that first 6 weeks where, I may be called to evaluate their wound, but they're struggling with, depression and anxiety and, physical ailments, bilateral carpal tunnel, back pain, high joint dysfunction. There was so much more. And going into their home, it took me back to my own journey as a mother. And I started reflecting about my experience postpartum. And I had a really difficult time in my postpartum period. And I felt that I was alone on an island, per se, and nobody really understood. And it was this like crazy, initiation into motherhood that everybody has to go through. I struggled with back pain. I struggled with deep postpartum depression, and I had no one. And at my 6-week appointment, I was cleared for physical activity, cleared for sex. And then, the journey of healing was almost a year-long process of trying to find myself. And so looking at, the patients in front of me and remembering my own journey, I felt empowered to speak more about my experiences and to find solutions in a way that I can help other mothers go through this. So as I was sitting, on my desk and I'm thinking, we really need to get the word out and moms need more. There's a lot of attention that goes to pregnancy, a lot of attention that goes to, delivering and childbirth. But once a woman delivers, they're left alone to figure it out until that 6-week appointment. And at that 6-week appointment, it's short and there's just so much to cover. And so I wanted to write this. For people to understand that there's more that we can do for moms. There's more that we should be doing for moms. And also that it's not just the work of the OBGYN or the midwife. The OBs are busy. They are on the forefront of research, policy making, trying to, keep up the standard in obstetrics, right? Midwives are, delivering patients.
Mhm.
They may not have the same expertise as the obstetrician, but it's not just on them. Right, it's our policymakers, our government, our community workers, our birth workers, other physicians who really need to join hands and come together to be able to fight for maternal health and to get moms the help that they need. Because remember, a lot of the deaths that happen under maternal mortality are after a woman gives birth. So
Mhm.
we need to be doing more because 60% of these deaths happen after a woman gives birth.
So what are the major issues and lack of support that moms typically face or more commonly face in that immediate postpartum period?
So, I think in my practice, the things that I've really encountered are postpartum preeclampsia, high blood pressure, there is abnormal vaginal bleeding, and then there's the postpartum mental health disorders. So, when a woman delivers, they're sent home and they're told if you have a headache, if you have blurry vision, abdominal pain, all of these things, give us a call, and because we could be worried about X, Y, and Z. But here's the reality: a woman goes home, they're taking care of their child,
Yeah.
they may be taking care of their home, trying to maintain a relationship with their spouse. They're not thinking, oh, this headache could be life threatening. They're not thinking, oh, these aches and pains, the swelling could be life threatening. They're thinking normal part of postpartum. They're just going about their day.
Mhm.
Right. And so when I've gone into moms and I maybe am going in for one issue, I always check a blood pressure. And I've cut at least two or three moms who've had life-threatening blood pressures and have had to go into the emergency department or back to labor and delivery where they've had to be admitted for postpartum preeclampsia. And I think if I wasn't there for their one particular issue, they could have gone to bed and they could have died and never woken up. So these are the issues that are really, taking away the lives of our moms. Postpartum preeclampsia, hypertensive disorders of pregnancy, strokes, heart disease, all of these things require additional screening because patients are not always going to look within and do a body scan and say, let me call my doctor because, I have X, Y, and Z.
So from a policy standpoint, what are some things that we can do to help? Should we just move the follow-up to a shorter time period, more resources? Obviously, what you're doing, you can't necessarily see as many patients as you would like to see. So what are
Mhm.
some solutions that we can do to solve this?
Yeah, so I think we have to look to other places that are doing the work, right? In the article, I focus on other countries who have done similar things. For example, France, they're sending people to their home, right? They're sending people to their home. They're sending nurses. They're sending pelvic floor therapists, sending lactation workers who are able to do this work. And if you train lactation workers or pelvic floor therapists not to just stay within their field, but
Mhm.
to also ask questions to, how are you feeling? Any thoughts about hurting yourself? Or tell me about what you're experiencing, or having these people be able to check blood pressures. I will say one thing that I know Kaiser Hospital has implemented, at least the Kaiser system in Atlanta, is that every woman is being sent home with a blood pressure monitoring. And they're having a lot of remote tracking where moms are going to have to check their blood pressure within those couple of days and they have to send it into clinic. But that's not standard for everybody. Some clinics also are moving the follow-up from 6 weeks to 3 weeks. I know some of my colleagues want to see some of their high risk patients pretty, early on instead of waiting to the 6 week mark. So I would say, trying to get our moms seen earlier. If they can't get into clinic and be seen earlier, let's utilize our community resources. We have doulas who are able to go into the homes. We have nurses who are able to go into their homes, right? And all these people need to be integrated within the system, right? It shouldn't just be here's a doula, here's a lactation, here's a pelvic floor, therapist. We need to create alliances and networks that are going to surround mom and be able to screen for life-threatening medical conditions and meet her where she is. Because let's face it, leaving your house to go to clinic when
Mhm.
you have a child, when you have other children, when you don't have the support needed to be able to get the help that you need, it's really a setup for disaster. And so I think our policymakers have to find ways of integrating other models of care, integrating other birth workers within this to sort of shield mom and protect her from, these conditions.
And just to be clear, other than a few patchwork solutions, like you mentioned with Kaiser, new moms typically are sent home without really any of the support. They're
Mhm.
not sent home with visiting nurses. Traditionally, they're sent home and come back in 6 months. Am I getting that right?
You were getting that correct. At 6 weeks, they're told to come back for their checkup. At their check, you can imagine you go home. In 6 weeks, you've accumulated probably 100 questions. You've probably struggled with breastfeeding. You've probably had, a clogged duct and mastitis by then. You probably barely can walk because of your back, discomfort, your SI joint, issues, your bilateral carpal tunnel, your anxiety, your depression, your worry over your child. You have 100 problems that you've accumulated. Now to go to try to bring that to your physician at 6 weeks in a general clinic visit, there is no time. Imagine how many patients an OBGYN is seeing for this type of thing. They don't have time to go through individual personalized questions because everybody is different, right? Everybody's not going to follow the textbook. And so it's not enough time given for an obstetrician to be able to screen women for all the problems. And it's just not enough time to discuss and go through and connect mom to resources. One of the things I talk about is, when I was dealing with my postpartum depression, I went to my OBGYN for my 6 week appointment. I went to pediatricians for my child's checkup. I took all the tests that are required to screen for mental health disorders, and I scored badly. And then I was told, you need to get the help that you need. You need to find some resources, but no resources. I wasn't given a sheet with a therapist or a psychiatrist. I wasn't given a list of support groups. I wasn't sent to a community to help me heal. I literally was sent back home feeling the same way until a neighbor came and said, listen, this is what you have to do. And if she wasn't there, I honestly don't know where I would be without that help.
Now, as you know, with these policy changes, sometimes they go through, sometimes they don't. And even if they do go
Mhm.
through, we're talking about a matter of years. What are some shorter term solutions that the healthcare system can make in terms of addressing this issue more immediately or more feasibly?
Yeah, I would say policies take a while. I mean, I think it's Mommy Bus Act. It's really been in the hands of Congress for a very long time. And so you're correct. Policymakers may not push this forward. So I think it's going to be, in the onus of the individual clinics is going to have to be in the hands of insurance companies who are going to, people don't know that you can have lactation come to your home, and insurance companies are not going to tell you this,
Hmm.
right? As soon as you get pregnant and you give birth, these resources should be pushed to you. But insurance company is not going to tell you, hey, you have covered lactation, you have covered pelvic floor therapists, and these people can come to your house. They're not going to tell you that. So it's going to have to be, OBGYNs getting on board, using the resources that they have. Before there was this kind of like, fighting match between doulas and OBGYNs.
Hmm.
But I think now they've embraced doulas because they understand they can't do all this work. And so there's more of a collective, society when it comes to helping moms. But I think we need to do it better. So OBGYNs utilizing their doulas, having a birth network when a mom is pregnant to say, this is your team, this is who you need. And also, I think what the community is doing really well right now is birth workers are getting together. Here in Atlanta, there's meetups where there's lactation specialists, there's pelvic floor therapists, mental health workers, midwives who are getting together. I will say that my OBGYN colleagues often are not in those meetings, but like I said in my article, they are busy. They still have to pour into themselves while still doing the clinic, the surgery, the leading the way with policy, maintaining the standard of care. So we just need to find a way for OBGYNs to get involved in this work, for midwives to get involved in this work, and to have the community also back them. It needs to be a joint effort for sure.
Now, for those new moms who may be listening to you now, are there any resources that they can request so they have someone to turn to? And you mentioned the example of lactation consultants that are available to them. Any other resource they should specifically ask for before going home?
A blood pressure cuff. if it's not a blood pressure cuff, it's sort of, one thing I give all my new moms, I wrote a book called What to Expect Next. And the reason I did that, and I tried to give it to different OBGYN clinics, the reason I did that is because I think moms often don't know what to expect, what to ask. And so having resources and guides, check off lists to go through and say, today is week 2. How should my bleeding be? Right. And I go through that. This is how much you should be bleeding. If this much bleeding is happening, talk with your doctor, or what does your blood pressure say? If your blood pressure is above this, talk with your doctor. And so having guides is really helpful of what symptoms to look out for. OBGYNs can definitely come up with that information to give their patients. Pamphlets, there's podcasts out there. I am a huge believer on, self-advocacy. I think if our policymakers are not doing it and your provider may not be able to have the time to do it, you have to take that in your own hands. Several podcasts you could listen to that will teach you about, the fourth trimester. There's fourth trimester voices. There's a birth squad. I could name a whole bunch of different podcasts that can help you know what to look for. And then there's support groups all over. Join a Facebook support groups where you can get, with other moms and hear from them and know that, oh my goodness, maybe this thing I'm experiencing is not normal. And there's in-person support groups everywhere in Atlanta. There's Mesh Moms. There's, Atlanta mom group meetups. There's so much that you could utilize, but don't be in a corner by
Mhm.
yourself. This journey is not meant to walk alone. We've seen it in many communities around the world where the communities literally surround mom and are vigil. They're looking out for symptoms. This is not the time to be out on an island by yourself because you're dealing with so much. Your body, your mind is changing, and you need somebody there with you to be able to point out and look when something is going wrong because you may not realize that on your own.
We're talking about the KevinMD article, Postpartum Crisis, a physician's call for comprehensive maternal support. Dr. Chowa, we'll end with some of your take-home messages that you want to leave with the KevinMD audience.
Yeah, so, I want to emphasize for our audience, personalized, patient-centered care is so important. Oftentimes in our medical schools and residencies, we're really taught to look for certain signs and symptoms, but everybody may not present in that way. People are not just physical, right? There's the environment they're in. There's the social, the social environments they're in. There's the mental, the spiritual. There's so much more. And so when you're looking at a patient, treat them as an individual. They may not be the patient who come to you with, the headache or the book signs and symptoms. You got to ask the right questions. You got to ask and know their environment. Do they have the support that they need? So it's extremely important because people they come with their own stories, they come with their unique needs, and we just really need to take a step and go beyond what we see and ask more. And we'll find out more and we'll see that it goes deeper than the surface.
Well, thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you so much for having me.